Hello, this is Chris with Meeting of the Minds. In this episode, we're going to get into some very basic first principles thinking about value-based care, stripping away the complexities and focusing on where you might be able to get started in your organization. But first, I have to have a little bit of an interruption to share some good news. Antwan D. Williams, who was at Henry Ford Health System at the time of the interview, has moved on to take on a Chief Operating Officer role at Orlando Health South Seminole Hospital. So very big congratulations for him as he moves into this new role and continues his duties as a co-founder of the Advancement League, which puts on the Young Health Leaders Summit, which is honestly one of my favorite conferences of the year. Thank you again. Congratulations to Antwan, and we're going to get into the show.
Think about the simplicity of a money-back guarantee. You go to a Midas or a Pep Boys or a Firestone and you get your oil change. You pay for a service. You know exactly what you're paying for. And if things don't turn out like you planned them to, what happens? You get your money back. I think value-based care is trying to get us to that point where you know what you're paying for, you know how much it costs, you know what the outcome should be, and if the outcome is not that you expected, then you get your money back.
All right, what we're bringing on today, Antwan D. Williams, VP of Operations at Henry Ford, also a co-founder of the Advancement League. We're going to go deeper into those, but the session that we're digging into is called, what's that session called?
So it's called It's About Damn Time, inspired by Lizzo's song. So it's all about value-based care and consumer pricing transparency.
That is huge. It's about damn time. I think that that's a subject that's given people a lot of confusion, stress, headache, as they navigate between like the fee-for-service environment, value-based environments, and really, I want to dig into that subject matter, but also dig into a little bit on the Advancement League and some of the things that you're doing for young healthcare leaders, for people that are thinking about these things, to be prepared to make the changes needed to re-incentive to align the incentives in healthcare in the right way. Am I hitting?
Yeah, I think you're spot on. I think when, as I kick off an introduction, I like to say that beyond most things, I'm a connector of people, and I think that's the foundation of the Advancement League. That's the foundation of my role on the value-based care panel later today at Vive, and I think it's who I am in my day job as a hospital operator and hospital strategist. And we've just been fortunate to pull together a community of amazing individuals that happen to care about healthcare, care about doing things the right way, and care about solutions. And I think you'll see that as a common theme on the topics that we'll touch on today.
Fantastic. Well, I'd like to dig into that theme as it applies to Antwan D. Williams.
Yeah.
Specifically, when it comes to founding an organization, thinking deeply about alternate payment models and how young leaders approach that. What's captured your interest in this movement towards alternate payment models? And just talk to me about like your personal motivations behind this and how you've grown into this.
Yeah, so I'll start off by saying that I'm the oldest of 10 siblings, and over the years I've learned to listen.
10?
Yeah.
Wow.
And you have to listen to messages, 9 different ways when you have 9 siblings. And and I think about the Advancement League and where we started. It started by listening. Folks were going to the same events, talking about the same topics. At the time, 10, 15 years ago, talking about value-based care and how they weren't seeing it at all. They studied it all through graduate school, all through undergrad, and got into their profession and hadn't seen it in action. And we said, wow, we need to build something new. We need to give folks another option. And that's how the Advancement League started. At the time, we were and still are passionate about community impact, about social determinants of health, and I think we're starting to see the world catch up a little bit. Mm-hmm. We're forever optimistic, but we know that time is ticking. The projections that we set around value-based care, around shifting from fee-for-service, around these models, we're off. If we were gambled with our life, I don't think we'll be having this conversation today. So I think we need to move a little bit quicker, and we need to push on the players that be to help us do that.
Well, let's let this conversation be a little bit of a help to that, because again, I alluded, we know that a lot of people are overwhelmed. They might have studied these things, but not understand how to put them in practice. And one thing that I was really eager to dig in with you on is how the Advancement League focuses on getting the hands dirty.
Yeah. So we emphasize in capital letters do, right? So it's one thing to talk about these high level topics and how applications can help us, make better decisions and, getting to the point where our hospital bill is as simple as our grocery bill. And then there's another thing to understand that regardless of the solution, that there are people behind those solutions that will reap the benefits of it. So anytime we meet in a place such as the beautiful city of Nashville, we prioritize a couple things. One is to connect with the local leaders that are in the trenches, that are doing the work, that live here, that pass through the communities that need the help. And then the other thing is to tap into the community needs. We all study the data. We know the community health needs assessment, but we prioritize getting out there and talking to the people. And again, that concept of listening. So just yesterday we did that. We had a ice cream social. We supported a local ice cream truck, a mom and pop business. We brought together a number of healthcare leaders from the area through the Nashville Healthcare Council. We talked about the real issues that the city's facing, and that's something that we think is going to be a secret sauce to large-scale collaboration. And when we figure out value-based care, the secret to sustaining it.
Then let's go all the way to the basics then, because one thing that happens when you have these terms that have a lot of academia, research, and things like that around them, and then they get bandied about on social media, you hear it so much that it loses meaning. Can you bring everybody back to a good basic definition of how you define value-based care?
Yeah, so I think, emphasis on the word value, right? So it's not paying for something just to pay for it. You're paying for something because it fixes something you need. When I think about that utopia, it's not complex. It's not left hand, right hand, insurers involved and things of that nature. It's that simple.
Well, it's simple. It's so simple that I want to plagiarize it, because I think that when I describe it, it is very confusing. But when you think about it in terms of you get your money back if the care isn't delivered to your car appropriately, it kind of takes away that incentive issue that we have with fee for service.
I think the people should hear your definition though, just to balance it out, just to make this a one-stop shop for all things value-based care.
Let's take do the one-stop shop approach. The way that I try to simplify it is to describe you're looking at the overall health of a population. And rather than like the incentive structure right now in fee for service, like if I go to Midas and I have a car problem and they fix it, but then it breaks down and I come back, well, they're getting double paid. Well, rather than that model where each time something happens, that there's basically an incentive for my car to be broken or an incentive for me to be sick under the current model, we're shifting the structure, allowing these organizations to take on that risk, so that rather than me coming in over and over again being profitable, if the hospital owns the risk and owns the health system owns the risk and the dollars around me, then it just changes the incentive structure and changes really the whole way that they think about how my healthcare experience should be.
Love that. And let's build on the car example again, just to really articulate the power structure and the with great power comes great responsibility as you think about the healthcare field. When you go to get your oil change and the guy or gal comes around the corner and says, hey, you also need your brakes flushed. You also need some new windshield wipers. You feel empowered to say no or yes. But if you come in for, a knee surgery and before you go into anesthesia, say, yeah, you probably should, get an x-ray and you probably should get a CT. Your confidence level, unless you live and breathe and happen to be a physician, your confidence level to say no to any of those things, if you even get asked the question, are slim to none. And I think that's where the responsibility comes in, and that's what value-based care hopefully will solve, is that, to your point, we as healthcare providers are incentivized to make all that make sense in one swing and not charge and, reap the benefits of charging for each of those individual things. So we'll get there.
Yeah, and that's a whole nother subject too, is the confidence that it takes to stand up for what you need and stand up for how you should be represented in care. Sadly, we can't touch on that in this episode, but hopefully you want to come back and talk to us about things like that. But let's talk about getting down and dirty.
Okay.
I'm going to have some questions about who should own these initiatives, the types of transformations that people should focus on if they're trying to, if they have a little bit of value-based care contracts and they want to grow, or if they're completely new, like how to build coalitions around it. But starting out, like I was watching some interviews that you had about the Advancement League, and some of the exercises that you have during the Young Leaders in Healthcare Summit to get people's hands dirty with value-based care. Can you talk about how you start getting people's hands dirty and getting them just in that system or mindset or doing things?
Yeah. So anytime, again, we meet, we have our Young Health Leaders Summit coming up in North Carolina, July 31st through August 2nd. We build that summit on the foundation of community impact. So not volunteering, but actual community impact. We believe that if we can keep it at the forefront of who our members are, who their purpose are, then that value. So what we do is we take sponsorship dollars, we break folks up into teams, we give each team cash from our sponsors, and we say, hey, think tank style, Shark Tank style, you have 24 hours to do good in the local area. So you have folks that are extremely smart, extremely passionate, and experts at what they do in their field, creatively collaborate with low resources, with not a lot of time, to do good in the local area. So they go out, they find the local leaders, they partner. Some teams have combined dollars to make more of an impact. And we think that that does a lot for your mindset. When you go back to your community and you're thinking about strategizing and solving the world's problems, I think you think about the kid or the family or the community organization that you helped at the Young Health Leaders Summit. And we hope that lives on at least till next year. You come to the next summit, or you join on as a member, and you keep that in your heart throughout the year as you're serving in various capacities.
So you're bringing people in and having them break out of that four walls mindset, break out of the idea that everything that they need to support is within that health system. You're getting them to think about the coalition building that it takes to address healthcare needs outside of just the procedures that people can have when they come in for inpatient, outpatient visits.
100%. And now we're attracting people that are starting companies that are figuring out the future of healthcare. So what we've always said is that the future of health is together. It's going to take the traditional hospital operators, the folks that are deciding to apply their education to building solutions from the ground up, and it's going to take all of us coming together around these common goals to make change.
So we talked. We spoke earlier about studying value-based care in college and the academic principles and things like that. And obviously, you're very focused on getting into practice. Who should own that in that the health system? We've got innovators listening to this that are within health systems and outside of health systems and things like that. But from the health system context, who should own the transition into it?
I think it's not to point finger, but I think it's the word together. And I'll give you an example. Last year we had our summit. We had a big conversation around cancer and the cancer moonshot. And I'll tell you, as we had that conversation, a lot of folks pointed out Big Pharma and said, hey, they need to figure it out. They're incentivized in different ways, et cetera. And we looked around the room and we didn't have Big Pharma in the room. Mm-hmm. So this year we have tracks such as Pharma as Friends, where we're pulling in our pharmaceutical leaders and partners, payers as partners, where we're pulling in insurance companies, et cetera. Policy passing conversations where we're pulling in lobbyists, politicians, et cetera. Health tech, and then all of the traditional players to build this safe space for us to have conversations and, to your point, roll our sleeves up to build solutions together. So I think it's going to take all of us coming together again around those common goals. And I hope we can do that at small scale in July and take it on beyond that as we exit.
And curious about doing that at small scale. Let's say you're an operator or a leader within a healthcare system, and there could be a small amount of value-based care contracts, or it could be something that's just not even on the radar. Do you have thoughts around how people get these initiatives started or grow them within their organizations?
I think it's asking the questions. To your point, you have organizations where they have a team of 2, and you have some with a team of 20. I think it's sitting down in a constructive way and thinking about how you're incentivized and what you're working on, and how do you align the dots. As I think about something as simple as a service line strategy, where we're trying to grow market share for orthopedics and heart and vascular and urology and women's services. One metric on my scorecard may be value-based directed. And that's not a hard conversation to have with a team of 2 that's doing the work every day, or the team of 20. That looks a lot different for someone who's working in the pharmacy. But again, it's trying to find those connection points and trying to measure it. And sometimes that's one KPI, and sometimes that's a whole initiative. So every bit counts. Every bit counts.
I hope that people listening get a little bit of inspiration from that they're not having to wait for an entire board of directors or a multi-billion-dollar company to change its strategy to be able to start delivering value and growth at the same time.
Oh, you're spot on. I use the analogy. Deion Sanders, left Jackson State and went to, Colorado University, and folks are giving him a hard time, and that's neither here nor there. But one gentleman said, "Hey, as you all are throwing rocks, even if it's $2, have you gave $2 to HBCU?" And I think that's similar to the problems that we have in our industry. It's not always the large rocks. It's what is the one thing you can point to that you're doing to move the metric, and those incremental changes add up.
And when we talk about the incremental change, I think that a lot of the times, like that for organizations to put their backing behind things, you have to earn it. Like if you start small, and you're trying to coordinate it with your peers, you earn it through the types of reporting and KPIs and things like that you measure and report on. Could you talk a little bit about what's reported and how to socialize it among other leaders to help sustain these initiatives?
Yeah, no, I think you spoke on it earlier that the incentives are changing, and the organizations that will bear the most fruit and do the most are going to be the ones that have been tracking it for a while. Reimbursement models are changing, et cetera. So I think it's going to look a lot different for everyone, but there is for sure at least 2 or 20 people in your organization that can help you figure it out. And I think it starts with that question within each organization. So I won't begin to try to answer that, but I think it's self-reflection, and everyone listening just sending an email and asking the question.
Any particular initiative that you've seen in value-based care that you think is an example people should read up on, study? Any examples of people who have done things that you'd like to share?
Yeah, I have to shout out, and they're a small player. I have to shout out Orlando Health. There's a guy he's a young guy, last name Burkett. He's doing great work with Orlando Health. They're incrementally making the shift and increasing the amount of patients covered through value-based care contracts. As we, 2020, 2005 and 2010, we were hoping to, hit this threshold of 20% of our patients are value-based care, and I think they're doing way more than that. So I think they're a good model to look at. I think Geisinger has some good money-back guarantees as you think about specific procedures in orthopedics. And I think some of the panelists that we'll talk through today, such as City Block, Walmart Health, Hospital for Special Surgery out in New York, and DaVita are doing some fantastic things in the space. So I think those are the companies that you should look at. And then I have to shout out Henry Ford. They're restructuring and collaborating in different ways. So Googling those organizations, connecting with the leaders, I think will bear a lot of fruit for everyone listening.
Fantastic. And this is the question that we ask everyone, is if you could change one thing about how healthcare is delivered in this country, what would that be?
Price transparency. As a consumer and as someone that has spent a lot of time in the hospital on the patient side and the supporting patient side in the last 24 weeks, I would say that just extreme price transparency. What am I paying for? What did it cost? Just making it as simple as my Whole Foods receipt. I'm not happy with the receipt, but at least I know and I can plan better.
So honestly, to be fully transparent with you, we've asked that question to each guest, and over 50% of them have been around changing the incentive structure around how healthcare is delivered. So we decided that this episode would be addressing that question.
Love
that now we go deeper into it. We've gotten the opportunity to go deeper into who's doing what, where, why, how. Now, as a connector of people, how's the best way for people to connect with you?
You can find the Advancement League on Instagram at Advancement League. You can always reach out to myself, Antwan, or my co-founder, Alex, at hello@advancementleague.org. And, we're on all the social platforms, and we love to connect, and we love to have good people involved.
Antwan, big thank you. Again, I love getting practical. I love hearing from people that are getting their hands dirty. I hope that people watching they might have seen a lot about value-based care, but now you've provided some examples and organizations, things to Google, things to research about specific things that they can change incrementally.
Absolutely.
Well, fantastic. And for the folks that want to dig in a little bit more on value-based care initiative and what the impact is to the patient, we've actually had some really good conversations on here. One that I want to point everyone to is Dr. Thomas Cornwell. We sat down with him and got deep into, as a doctor, he talked specifically around the patient experiences and different things that have been enabled from value-based care programs. Again, thank you, Antwan.
That's awesome. Thank you, man.
If you enjoyed that conversation, you can find all our episodes and transcripts at wobothealth.com/meeting of the minds. There you can subscribe, which will keep you in the loop on new episodes and our LinkedIn live sessions with healthcare leaders like the one you heard today.